Back to you.
I appreciate it. Thanks so much, Kristen. It is Cervical Health Awareness Month, and that's why cervical cancer is the focus of this morning's Healthy Living House Call, sponsored by Advent Health. And so joining us now is Dr. Subia Rahman, Advent Health OB/GYN physician. It is so good to see you again.
Nice
Thank you so much for coming in. So we hear cervical cancer a lot, but what exactly is cervical cancer?
So Danielle, cervical cancer is the fourth most common type of gynecological cancers found in women. It is cancer that develops in the cells of the cervix that line the cervix, which is the lower part of the uterus present on top of the vagina. It happens because there are certain changes that occur in the cells of the cervix, and with time these cells, they grow out of control. That leads to cancer.
What causes it?
So, very good question. So, cervical cancer in 99% of the cases is caused by what we call human papilloma virus, the HPV virus,
okay,
which is a sexually transmitted infection. So, the cells of the cervix, they get infected by HPV, and with time, this HPV causes changes, what we call high-risk changes that can lead to cancer. Now, it is a sexually transmitted infection, and most women will get it during their lifetime if they're sexually active. However, most women, especially young women, their body clears it. Most HPV infections, they get cleared by the body. Sometimes, however, especially if you are infected with this high-risk HPV, these infections tend to stay in the cell, cause changes with time, and that can lead to cancer with time.
We've got just under a minute left, and there's so much more I want to ask you, but I think one of the more important questions that probably our audience wants to know is something like this preventable, and what about screening and early detection?
Correct. So, very important question again. There is a screening test, and the most common one is the Pap test, along with HPV test. Previously,
would you ask for that when you get your Pap test, or is that part of your Pap test?
So the Pap test is different than a pelvic exam. We do Pap test with pelvic exams, and previously we used to do them every year, but with the change in the guidelines in 2012, we do them every 3 years, and we begin doing Pap smears at the age of 21. So 21 to 29, we do Pap smears every 3 years. Between ages 30 through 65, we do them every 3 years if we do only the Pap smears. We can extend it up to 5 years, the screening, if we do along with the Pap test, HPV test. But that's only in ages 30 through 65.
So make sure that you get tested. That is the most important thing, and it's something that is survivable, obviously.
Exactly. And then it is a highly preventable disease because, one, it's caused by HPV, which is an infection. Two, that we have a highly effective vaccination, the HPV vaccination, which we recommend getting in all prior to the exposure to HPV, which is around the age of 11, 12. So it is highly preventable. For me, we can dramatically reduce the incidence, the number of new cases of cervical cancer because of this HPV vaccination.
Well, I got to tell you, I loved how you explained it. You made it very clear and easy to understand. So thank you so much
Thank you, Danielle,
for coming by. I appreciate it.